Good morning, welcome back. Well, we're talking Parkinson's disease this morning, and joining us from Gunderson Health System to shed some light on the disease is Rachel Biemiller. Good morning. Thanks for waking up with us.
Good morning.
So Parkinson's disease, I have an anecdotal experience with this. My grandfather had it, and I know it involved he had a shaky hand and kind of a diminished capacity for speech, but what exactly is the disease?
The disease is part of a class of diseases called neurodegenerative disease, which means part of the brain is quite literally being destroyed. It's a progressive disease that unfortunately we have no way of stopping. For Parkinson's, it's destroying a part of the brain that produces something called dopamine, and dopamine helps us move smoothly.
What are some of the signs and symptoms of Parkinson's?
There's quite a few, but the classic symptoms are stiffness, slowness, tremor, and poor balance. Though I should point out that about 30% of people never develop a tremor, which actually prevents people from being diagnosed early because everyone assumes you must have a tremor to have Parkinson's disease.
I suppose if that's a typical sign of it
sign
that people look for. I mean, the one that's associated with the disease, that's pretty easy to notice then.
Is there a certain age range or type of person that this affects?
It can affect anybody, but typically patients are in their 50s or 60s when they develop the disease, though I've seen patients be diagnosed in their 80s and some as young in their 30s.
And right now there's no cure, so how exactly do you treat the disease?
Well, right now our main focus is treating the symptoms. So most of our medications are aimed at replacing the dopamine that's being lost. And we have different medications. One is Cinemet, that's pure dopamine. Another class of medications is something called dopamine agonists that mimic dopamine. And then we have some more invasive procedures such as deep brain stimulation, where we actually stick an electrode in one's brain to send an electrical pulse to help with the symptoms as well.
Now, you mentioned the age range that it typically affects, but do we know kind of how this comes about? Like, is it a genetic thing, or is it something that can be brought on by some behavior earlier in life?
So that's a really good question. Unfortunately, we really don't know for the most part. There are some genetic forms, but we're looking at about maybe 2 to 3% of all Parkinson's disease. Sometimes repetitive head injuries can bring on Parkinson's, but the vast majority of people, we still don't know why it happens or how people get it or why it progresses the way it does.
All right, Dr. Biemiller, that's all the time we have this morning. Thanks so much for joining us.